Let me speak on management of systemic hypertension, a simplistic approach. What is hypertension? Is systemic hypertension? It is an abnormal elevation of blood pressure that is due to increase in cardiac output and peripheral vascular resistance. If you treat the increase in cardiac output and peripheral vascular resistance, automatically you can bring down the blood pressure. Again, the management, the first and foremost is lifestyle modification and dietary approach is important. Just remember by mnemonics A, B, C, D, E, F. That is called hexagonal approach. Hexagon has got 6 sides like that. Just remember A. What is the first drug? A for angiotensin converting enzyme inhibitor. That is, so many drugs are available: enalapril, ramipril, perindopril, and the first and foremost drug is captopril. Nowadays we don't use much captopril. Next is angiotensin receptor antagonist. What are they? So many drugs: losartan, telmisartan, olmesartan, fimasartan, so many sartan, angiotensin receptor antagonist, that is renin, angiotensin, aldosterone antagonist. They are very important. The losartan is very helpful, especially in systemic hypertension with hyperuricemia. Next, telmisartan, olmesartan, both are equally effective. The only difference is that is telmisartan is a lipophilic drug and also it has got a mild effect on peroxisome proliferator gamma receptor, whereas our olmesartan is the least lipophilic drug. So, these are the drugs A. Then B for blockers, that is alpha blockers and beta blockers, prazosin, trazodone. It is especially useful in prostatic hypertrophy and systemic hypertension. Next is our beta blockers. So many beta blockers are available, and the first and foremost is the cardioselective beta blockers. The most important thing is, one is our metoprolol, next is nebivolol, next is bisoprolol. They are called a lipophilic drug. So the metoprolol and also the bisoprolol, what do you mean by lipophilic? They cross blood-brain barrier and prevent sudden cardiac death. Nebivolol has got an additional advantage. The reason is it creates L-arginine nitric oxide synthetase. So it causes vasodilatation. So beta blockers are very helpful, especially in systemic hypertension and also cardiac failure and also with the reduced ejection fraction. And the non-cardioselective beta blocker, the propranolol. Propranolol is useful only in portal hypertension and also correct for hypokalemia. Next is C. C for calcium channel blockers. One is dihydropyridine derivatives, another is non-dihydropyridine derivatives. The two drugs main important non-dihydropyridine derivatives, verapamil, diltiazem. They are especially useful in not much in systemic hypertension, especially when there is associated diabetic nephropathy, when there is no other drug useful and indication, then we can use verapamil and diltiazem. But we have to be careful systemic hypertension with the LV failure, because both these drugs, diltiazem, verapamil, have got a negative inotropic effect. The other calcium channel blocker, that is dihydropyridine derivatives, starting from nifedipine, amlodipine, then efnodipine, cilnidipine, then so many drugs, that is azilipine. So they act on the 3 channels, that is, just remember L, N, T. N for presenting in neural receptor, N for N. Next, what are the other channels? Late, just remember late. L, that is L channel present in A, that is afferent arterioles. Then T, that is T channels present in efferent arterioles of the glomerulus. So the L, N, T, 3 channels acting, one drug, that is calcium channel blocker, that is the dihydropyridine derivative, is the benidipine, that has got a action on all the 3 receptors. So C is over. Next is diuretics, very useful. The diuretics, thiazide diuretics and thiazide-like diuretics. Thiazide diuretics, chlorthalidone and hydrochlorothiazide. The advantage of chlorthalidone over hydrochlorothiazide, it is more potent and also 1.5 times, that is duration of action is also prolonged. Next is thiazide like diuretics. One is our metalazone, another is indapamide. Indapamide is also very useful, metalazone more useful in nephrotic syndrome. These are the diuretics, and another important drug is spironolactone. Spironolactone, though it is a diuretic, if the patients are not responding to 3 drugs, we call it as resistant hypertension. Third drug is a diuretic. Even then, if the other diuretics are prescribed, we can add spironolactone as a 4th drug, because the advantage of spironolactone, it's a pannexin channel inhibitor. The pannexin channels are ubiquitously expressed in our body, that is in the smooth muscle. So pannexin channel, that is adrenergic stimulation, and pannexin channel activation that results in adenosine triphosphate. So if you inhibit pannexin channel, then the adrenergic stimulation is not there, then ATP release is not there. So instead of vasoconstriction, there is vasodilatation. So spironolactone acts like that. This is a very recent article. And next is our A, B, C, D over. Next is E, that is exercise dash, dietary approach, that is to prevent systemic hypertension, that is exercise and dash diet. Last but not least is 5, F, that is find out the cause for resistant hypertension, especially the drugs. Very important, the patients may be having drugs without telling us, they will be taking ortho drugs, very important. Just remember A, B, C, D, E, F, G, that is very important, H. Then A for, that is the acetyl salicylic acid, aspirin. Then anti-inflammatory drugs, that is non-steroidal anti-inflammatory drugs. So many drugs, aceclofenac, diclofenac, they will be taking, they don't tell us. Then B for biomodulators, especially chemotherapy, that is a cyclosporin, tacrolimus. We must ask the patient the history. Then C, corticosteroids, very important, patients will be taking for asthma and so many things, corticosteroids, and also contraceptives, oral contraceptives, they will be taking, very, very important, C. Then common salt, not but not least is common salt, C for common salt. Then D, that is the decongestants, patients will be taking ephedrine containing nasal drops, that is D. Next is erythropoietin, that is erythropoietin used to correct anemia. Whenever that is prescription of erythropoietin, we have to be careful, the patients will have resistant hypertension. Next is F, that is frequent ingestion of alcohol is also one of the contributing cause for resistant hypertension. Next is ginseng, again the patients will be taking the multivitamin, especially Revital and so many drugs, and the counter sale product, we have to be careful. Last but not least is the herbal supplements, that is huanha, ma huanha, that is a Chinese food supplement that also causes resistant hypertension. We must remember the secondary hypertension, other causes, that is the endocrine causes and the cardiac causes, coarctation of aorta. So all those things we must keep it in mind. So if you approach systemic hypertension carefully, we have to analyze the hypertension. So and also the cuff size is also very important, that is small, medium, large, extra large. Accordingly, we must select the cuff. It must be length 80% more and breadth more than 40%. We must always keep their hands on the table, very important. We should not tie the cuff over the clothes, very important. Next, they must rest the foot on the floor. They must keep the back on the chair. They should not have any conversation with the others. And also they should not have any coffee, tea, and they should not have any alcohol. If we do all this, keep all these things free, then we can have a good control of hypertension, and 1 kilogram of weight loss will cause the reduction of 1 to 2 millimeters of mercury. Also, that's why I told you that is the dietary approach, weight reduction. He has got a good control of systemic hypertension. Thank you very much. That's how we must approach systemic hypertension management.